Good morning, everyone. We'll get started in a couple of minutes. Okay, let's go ahead and get started. Welcome everyone to our third webinar that is co-organized by the George Washington University Climate and Health Institute and the Environmental and Occupational Health Department. We are thrilled to have you here with us today. And it is my pleasure to introduce Dr. Vijay Lamai. Dr. Lamai is a climate and health scientist at the Natural Resources Defense Council, and he leads economic valuation work to demonstrate the significant health costs of climate change. And he works to defend the science that underpins the Clean Air Act. Prior to joining the NRDC, he worked as a scientist at the US EPA, focusing on clean air regulatory implementation, air quality monitoring policy, risk communication, and citizen science. He speaks Spanish and Hindi, and he has published several research studies on the health impacts of climate change triggered air pollution and extreme heat in the US and in India. And he will share some of that fantastic work with us here today. We're very excited to have you here, Dr. Lamai. The way we're going to do this is Dr. Lamai will speak for about 40 minutes, and then we'll have an open Q&A session. Please put your questions in the Q&A box and indicate when you write your question, whether you would like to be promoted to a panelist to be able to unmute yourself and orally ask your question. Otherwise, I will ask the questions that are sent in the Q&A box after Dr. Lamai's talk. So thank you all for being here, and Dr. Lamai, the floor is yours.
Great. Thank you, Dr. Annenberg. It's really a pleasure to be with you all today. I'm excited to share some of our work on climate and health as it relates to economic ramifications. There's been, of course, a lot of climate coverage in the news given the summit in Glasgow over the last few weeks. So really happy to be here with you all and appreciate the invitation. So I'll spend about 40 minutes on my remarks, and then we'll have plenty of time, 20 minutes or so towards the end for a good, robust Q&A session. All right, so with that, let's get rolling. Let me just get this working here. All right, so I want to just set the stage in terms of the continuing and worsening burden of climate hazards on our country. To any of you who are in the US or really around the world, this past year, 2021, has been a really kind of scary signal in terms of the worsening impacts of climate-sensitive hazards. Just to give you a taste of that, this map depicts data from our federal government, the National Oceanic and Atmospheric Administration, NOAA. NOAA houses the Weather Service, and for 41 years, since 1980, they've been tracking the impacts of the costliest climate and weather disasters across the country. So NOAA has built this, 4 decades long database to help us understand the burden of these climate and weather hazards across the country each year. And every quarter, they update this information and release a public map. So this is the map from September 2021. It shows that this year, the United States has endured $18 billion disaster events. So these are the costliest climate and weather disasters that have hit the country. It's not everything that's happened across the country, just the costliest events. And we talk about climate and weather disasters here. I want to just at the very top of the talk acknowledge that not everything that NOAA tracks is necessarily a climate sensitive hazard. Things like that freak storm in Texas early on in the year, the tornadoes that have happened across the country this year are not definitively linked to climate change yet. But everything else on this map, when we're talking about historic wildfires out west, flooding in the middle of the country, the impacts of hurricanes and coastal storms in the southeast and the northeast. This country has really seen a preview of what's to come in terms of worsening climate damages this year. And whichever way you slice it, in terms of the number of the costliest events or the total economic damages that NOAA estimates from those hazards, the trend line is very clear. Things are getting worse. They've very clearly gotten worse since 1980. And it does appear that we're seeing very much on the ground the signal of climate change impacts in our country. So NOAA has been tracking the financial impacts of these climate and weather disasters. And they've been focusing on things that are relatively easy to count from a financial perspective. These are things that are insured or repaired. Think property damage or crop failure, infrastructure losses. And really, a big point of my talk today is that when we think about big national assessments like this, the human health ramifications of these disasters have really been missing from our understanding of the math and the overall conversation. The issue of climate change and financial damage has really been growing in prominence in terms of the overall climate discourse, especially since 2018, when the last National Climate Assessment was published by our federal government. The NCA, National Climate Assessment, is a every five-year effort to basically summarize the latest climate science in terms of impacts on this country. This report back in 2018 made a big splash, pointing to the fact that climate change is not some distant threat for future generations. It's very much a here and now issue, and that the costs and impacts of this problem are very much being endured by people across the United States right now. I'll just acknowledge that Allison Crimmins, who you heard from in an earlier GW seminar, is leading the next National Climate Assessment, and we expect to see even more detail in that fifth climate assessment on the ways in which climate change is expected to wreak increasing havoc on our economic system. So this issue has been gaining prominence, and this year we've seen, of course, a big federal discussion in terms of what to do about the climate problem. There has been a lot of ink spilled on the trillions of dollars that our government may or may not spend to deal with the climate problem, and a lot of focus on the costs. In fact, some people have asked, won't it cost too much? Can't we save ourselves these costs and continue to kick the can down the road when it comes to neglecting federal climate policy? Here, former Secretary Kerry, a special climate envoy for the president, answered that question for the press back in January. And I think it really sheds some light on part of the problem that we're trying to focus on with our research.
It costs a lot more. There are countless economic analyses now that show that it is now cheaper to deal with the crisis of climate than it is to ignore it. We spent $265 billion 2 years ago on three storms: Irma, Harvey, and Maria. Maria destroyed Puerto Rico. Harvey dropped more water on Houston in 5 days than goes over Niagara Falls in a year. And Irma had the first recorded winds at 185 miles an hour for 24 sustained hours. That last year, with one storm, $55 billion. So we're spending the money, folks. We're just not doing it smart. We're not doing it in the way that would actually sustain us for the long term.
So I think Andre Kerry really made a good point here in pointing to the fact that in many ways, we're already dealing and paying for climate damages in this country. We're paying a climate tax when you think about it. And I'll get into more about how we're paying. But I just want to mention that this issue in terms of financial impacts really is confined, like I said, to things that are not about public health, right? So the Lancet Countdown Report, a big global study and an accompanying US policy brief published just last month in October, pointed out that the really, totality of the cost of our continuing burning of coal, oil, and gas, fossil fuels, is really unknown. We really are not measuring the cumulative effects of this problem on the American populace, and certainly not in other countries that don't even have the data systems that we have in place right now. So that's really kind of the motivation of some of this work that I'll show you today. I just want to acknowledge and take a step back, point out that the field of climate and health really has been gaining ground over the past several years. This is a figure published by my PhD advisor way back in 1998, pointing out the connections between the climate crisis and human health. So Jonathan Patz and colleagues have been working along with Dr. Annenberg, many other leaders in the field over the years to make these connections more salient for policymakers and the public. Just to walk you through it, in case any of you aren't familiar with climate and health, I want to point out that we're talking on the left side here in terms of big changes in the way that our Earth's climate system operates. An anticipated increase, this is probably closer to now 3 degrees centigrade, depending on current climate pledges from different countries across the world, as well as significant sea level rise and changes in the hydrologic cycle. So extreme drought and extreme precipitation. Those changes, those 3 big changes in the environmental system, are linked to all sorts of different health relevant exposures you see spelled out in the middle of the slide here. Those in turn are linked to a whole host of health problems, and we'll really get into a lot more detail on the right side of this slide further in this talk, but I just want to acknowledge that this field continues to grow. That said, a recent estimate in 2017 estimated that climate and health research represents just 1% of all climate research happening globally. So very much this field is still in its infancy. We have a lot of work to do to catch up, to point out the ways in which climate change already is affecting the health of people worldwide, and the ways in which this problem will continue to define, in many ways, the health of all humans for generations to come. So this all brings us to the question of just how much is climate and the climate problem costing us in terms of damages to public health. Like I've said, this issue really hasn't received much attention, especially in the media, and that's for a number of reasons. These costs have been largely missing from our conversation on the climate issue in terms of the issues that we're facing as a country and what we can do about it. Like I said, we've confined a lot of the financial discussion to things that are not about humans, right? They're about property or infrastructure or crops. Health costs have therefore really been neglected in terms of these big assessments. That's for a number of reasons, some of them due to the lack of available data to make the connections between climate change and financial costs. And we've really been working at NRDC to try to surmount some of those existing data hurdles to try to establish at least somewhat of a baseline in terms of the scale of financial damage that we're talking about. So here I'll just dive into some of our recent work. I'll mention that this study we published 2 years back is publicly available, free, and this is in the journal GeoHealth. This was our really latest effort to estimate climate-sensitive health costs in a recent year across the country. So our approach here, rather than trying to really account for a comprehensive kind of sweeping estimate of maybe the national price tag from illnesses and injuries and deaths related to all these different climate problems, was to take more of a case study approach, to look across the country at a wide range of climate-related health harms and to try to use that public data to calculate health costs. Here, we're using what's called a combined valuation method. So we're focusing not just on the deaths related to worsening wildfires and heat waves and coastal storms, et cetera, but also the significant morbidity burden. That's the burden of illnesses and injuries that are triggered by these worsening climate hazards. Historically, a lot of the work in this field has focused, rightly so, on the mortality risks of things like extreme heat. But increasingly, we're seeing that climate hazards are worsening illnesses and injuries across the world, really. And so there's a need to consider both the mortality and morbidity side of the health picture here. Our study looked across the country at different states and different climate-sensitive health problems. So this is an animation depicting really the scope of our case study analysis. We looked across the country at 10 different case studies spanning 11 states. Each of the problems here, the environmental exposures here, is linked by the climate science to a worsening in the years to come. So we're talking about a worsening in frequency, intensity, duration, and/or geographic extent due to the accumulation of greenhouse gases in the atmosphere. So remember those 3 big changes in the Earth system: temperature increase, sea level rise, and changes in the hydrologic cycle, extreme drought and extreme precipitation. So this is a representation of sort of the scope of our case study analysis. We looked at just a single year in the United States, 2012. A lot of you probably recognize Hurricane Sandy on the right side of the map here, but it's important to note that a lot was happening in that year, even though it was a long time ago. A lot was happening that is, encompassing the sort of suite of climate-sensitive risks that we're thinking about even right now. So this, even for 2012, represents by no means the total burden of climate risks across the country, but represents kind of the mix of what we continue to face. Of course, 2012 was almost a decade ago, right? And so it's a fair question to ask, is this data as fresh as it could be? Part of the problem here in terms of tracking health effects and associated costs is that right now we lack real-time reporting of that data. It often takes many months to retrieve it, often years for it to appear in the published literature in terms of epidemiology studies, for example. So even when we were collecting the data for this study, 6 years or so after 2012, we were seeing new published studies about the health impacts of these problems. So we, in many ways, need a much more accelerated, proactive approach to identifying these health harms in real time. And I'll get into some of the work that's happening on that front later in the talk. So this represents sort of the overall scope of our case study analysis. We looked at publicly available data sets for all of these events. So we looked at the peer-reviewed literature and information from other sources to understand first the health burden, and then tried to connect it to federal cost statistics to understand the scale of the economic ramifications. So here's our sort of suite of different health costs that we considered. So you can imagine that if you are in an extreme event like a wildfire or a heat wave or an infectious disease situation, there's all sorts of health costs to consider. We tried to take a pretty comprehensive look at what those costs were, thinking about not just the economic drag and impact of premature death, but also the significant toll associated with illness and injury. So we're talking about, of course, the huge costs in this country associated with receiving medical care in an emergency room or even being hospitalized, but also the lost wages people may suffer as a result of staying in the hospital for multiple days or weeks to receive treatment and recover. Oftentimes, as any of you who've coped with a serious health issue know, you're facing costs that mount and continue for weeks into the future or even longer as you continue to try to recover. So the need for outpatient care, prescription medications, even home healthcare aids, physical therapy, et cetera, these costs really add up, right? We know that right now in the US, about 1 in 3 adults reports medical financial hardship. That means that they're unable or, to basically deal with receiving necessary medical care. They're delaying or completely foregoing that medical care because they simply can't afford it. So, we've had kind of parallel discussions nationally about reforming our healthcare system and dealing with the climate problem, but these really need to be considered as kind of two sides of the same coin. Dealing with the climate problem benefits our health, and that's a real, important message that I'll relay. I mentioned the data sources and kind of the patchwork that we're dealing with right now. Right now, of course, we lack a national integrated system from the Centers for Disease Control, for example, to track climate-sensitive health problems. And that's why I spent the better part of a year searching across public available data sources to assess the health damages, even in this relatively small case study set. So this table gives you a sense of the 36 data sources that we relied on, largely from the peer-reviewed literature, but also public data sources from state and local health departments and our federal agencies, including the Environmental Protection Agency, NOAA, and CDC. So the data is kind of coming from multiple places, and we built sort of here's a peek under the hood at our modeling platform to try to connect those health data points depicted here in the yellow boxes with all of the financial information, mostly in the blue boxes. I won't dwell on this method slide too deeply, but I'll just say that we relied on really the synthesis and integration across multiple data sources, looking at federal health statistics, especially from what's called the Agency for Healthcare Research and Quality, AHRQ. That's the federal agency charged with tracking how much it costs to receive treatment in hospitals, for example. And so we use those national statistics to arrive at more consistent apples to apples comparisons across the case study set in terms of financial costs. So this work in many ways was really about building a framework, an approach for doing this on a broader scale. Because so little of this national analysis has been done, we really were kind of building this model as we went, and there's certainly ways to improve it. But this really gives you a sense of the complexity of linking health and environmental and economic data into the single model. So in terms of what we found from that case study set, you can think of this table here as a bit of an update from that figure you saw from Dr. Patz back in 1998. This is the grim list of illnesses and injuries and causes of death that we uncovered in that publicly available data for the case study set. So we looked across the country. As you can see here, we're talking about all sorts of climate sensitive hazards. We're talking about infectious disease like Lyme disease in Michigan, or West Nile virus, an outbreak in Texas in 2012 that was severe. We're also thinking about air pollution problems. I work a lot on our Federal Clean Air Act implementation, and I'll say that the ozone smog problem is slated to get worse due to climate warming alone. That's because ozone smog is more likely to form at higher temperatures. So this list really gives you just a preview of the types of health problems that Americans are enduring right now, and that these problems are often kind of missing from the headlines, right? We'll see a report about wildfires in California or the extreme flooding, and we'll certainly see examples of the most severe cases like those deaths that occurred after Hurricane Ida this past summer. Oftentimes, though, we have very little visibility in terms of our media coverage into the illness and injury burden of these events. So this data was pretty startling to me as a researcher, because we really rarely see this kind of compendium in one place of all that's happening on the ground. I want to draw attention to a few impacts that this study really highlighted. First was the tremendous health consequences of increasingly severe hurricanes. Hurricane Sandy back in 2012 was, of course, associated with hundreds of deaths. We estimated about 273 premature deaths associated with that storm, which was significantly higher than public data from CDC. And that's because of all sorts of deaths that really appeared in the literature in the weeks and months following the storm. So they weren't, in the immediate statistics in the couple of days after the superstorm. Hurricane Sandy was also importantly linked to important burden on mental health as well as pregnancy complications. These are the types of problems that we're not hearing about because there just hasn't been a comprehensive effort at the state and federal level to understand what's happening in terms of health on the ground in the wake of these really severe events. I'll also point to fantastic work out of US EPA. The Environmental Protection Agency has been increasingly moving forward on trying to understand the impact of wildfire smoke on this country. Wildfire smoke is an important health risk. Increasingly, of course, we're seeing wildfire smoke afflict populations far from the flames. Our work at NRDC points out that the area affected by wildfire smoke can be as much as 50 times greater than the area directly burned by the flames. That's really important because the particles emitted from burning cars, structures, other materials in these, historic wildfires are mobilized and transported far downwind. The existing evidence indicates that the fine particles, those really small particles that are emitted as part of, in these wildfire events, are even deadlier than the same types of small particles that come out of tailpipes or smokestacks when we burn fossil fuels. That's because we're mobilizing probably all sorts of other toxic compounds, carcinogens, in these places where we're having all sorts of materials burned that were never meant to be incinerated, right? So increasingly, we're getting a better handle on the health problems associated with wildfire smoke. I'll say that our regulatory scheme for capturing non-attainment violations of the Clean Air Act due to wildfire smoke is really not where it needs to be. Right now, wildfire smoke days are basically thrown out of decisions in terms of determining compliance with the Clean Air Act because they're seen as not within human control. But increasingly, wildfire smoke is affecting the health of millions of people across this country and worsening heart and lung disease. So we need to get a better handle on managing that exposure risk across the country. I'll just say here that, of course, the literature continues to grow as we understand more and more about the ramifications of the climate problem for public health. So even that list that you saw on the last slide is by no means comprehensive, even for these case studies of what was afflicting people across the country. So with that said, I'll give you a taste of sort of the overall results of the study. So we looked across the case study set, 10 states in 2012, and identified a pretty significant health burden. We're talking about more than 900 deaths, 20,000 hospitalizations, and nearly 18,000 trips to the emergency room associated with each of these climate-sensitive hazards. So that's a huge public health toll, and one that we're not really hearing about, right? Oftentimes, we're sort of shifting our attention from disaster to disaster, losing focus on the cumulative burden of these types of problems. So this is very significant. And when we think about attaching costs to those health numbers, this is the kind of big headline number from the study on the lower right, $10 billion. We're talking about the costs associated with premature mortality using what's called the value of a statistical life. That's just a metric deployed by our federal government in regulatory impact analyses to translate premature deaths into economic terms. But also a significant morbidity burden. About $1.6 billion of the overall $10 billion price tag was associated with those tens of thousands of trips to the emergency room or hospitalizations. To give you some perspective on that $10 billion price tag in 2012, the NOAA estimate for the total climate and weather disaster damage that year was about $40 billion. So just scratching the surface here on public health damages from a small case study set, we're already adding 25% to the national bill for these climate and weather disasters. So this is really kind of a scary finding in terms of extrapolating beyond just this case study set. It's a fair question to ask, okay, you've got $1.6 billion in illness costs. Who's actually paying those bills, right? Our study had some limited visibility into answering that question. We identified Medicare and Medicaid patients as the disproportionate payers of those illness costs. So, those populations were overrepresented in terms of enduring health harms and the associated costs. We right now really lack the ability to more finely assess the financial impacts on individuals and families, employers, and insurers of this problem. But we do know that the science showing that the older adults and very young and economically disadvantaged are more vulnerable to climate harms. They're being hit first and worst. Oftentimes, these are populations already coping with serious health problems, and delaying or foregoing medical care, as I mentioned earlier, oftentimes makes people even more vulnerable to climate stressors and more likely to end up in a hospital. We know that right now our hospitals are not equipped to handle the shocks of the climate crisis. We saw in Hurricane Sandy hospitals struggling to keep the lights on, to keep the power running for folks needing dialysis care, for kidney disease, for example. And more, we need to focus on preparing our health systems in order to meet the growing challenge of the climate crisis and the patients that will be headed to hospitals to seek care for significant health issues. So the overall challenge here, though, is very large, right? So this was just a small case study set attempting to establish a baseline in terms of climate-sensitive burden on the country. Ideally, at some point, we would be able to calculate the national price tag for health costs from climate problems, like we're currently able to do through NOAA's billion-dollar disaster project. Increasingly, we're seeing the attribution science catch up here in terms of being able to attribute more and more specific health harms to the accumulation of greenhouse gases. That attribution work continues to advance. That's not what this study is about. We did not conduct climate change attribution, but rather is sought to establish a baseline from which future attribution work could build on. I will point out, though, that the attribution work is furthest along for understanding the role of climate change in making heat waves and heat-related illness and death more likely. But we have a lot of work to do on the attribution front to understand how climate change specifically quantitatively worsens specific health risks other than extreme heat. So towards the bottom of the slide, you see the big challenge here, extrapolating from a small case study set to the potential hundreds of future events that we're going to see each year if the climate crisis continues to worsen. We did attempt to try to extrapolate a bit from the data available just in our one study for 2012. So this bar chart gives you a sense of the share of health impacts captured in our $10 billion estimate. That's the blue portion of each of these bars. So it's percentage of the health burden that we captured. The remainder of the bar, the yellow lines, correspond to the known national health burden from each of these problems that we did not quantify in terms of health costs, right? So you can see that over on the left side, for a problem like Lyme disease, we only looked at the burden on one state in Michigan. And really, we know that across the country, Lyme disease was burdening many more people outside of just Michigan. So we only captured a very small percentage in our cost estimate. In contrast, on the right side, we think we captured a large degree of the mortality burden associated with hurricanes in 2012, given the availability of data. So you can see here that across different exposures, we're capturing different amounts of the ultimate health burden and health costs. But the challenge of extrapolating, even in a single year, is extraordinarily difficult just due to gaps in the data. I want to point you all to another piece we published last year in a great special issue of the journal Health Affairs, which was focused on the policy implications, health policy implications of the climate crisis. So this piece really sought to build on our case study analysis and arrive at some recommendations in terms of how to further deploy this climate health cost evaluation approach. Really, we're pointing out that we need to understand the financial burden of health problems on all sorts of people across the country, right? We know that people are seeking insurance coverage, oftentimes through their employer or through government insurance like Medicare or Medicaid or the open exchanges. Those systems increasingly are going to be coping with the financial shocks of climate change, right? And so we need much more integrated planning at CDC, the Center for Medicaid and Medicare, services to understand the implications of this growing cost burden on the solvency of their programs. We also believe that talking about this issue in terms of cost can connect and help it resonate with people with whom it's maybe struggled to resonate prior, right? So if people understand that their own health or their children's health is being threatened and that has also financial implications, that could be a way to convince additional people to get into climate advocacy. We really need more people thinking about the climate problem and advocating for strong policies to deal with it. It's also important that we better invest in public health in this country. I think anyone who's lived through the last year and a half in the US probably has been surprised to see the Centers for Disease Control and Prevention struggle to keep up with the tracking of COVID-19, for example. In fact, CDC has been using fax machines, recordable CDs, emailed spreadsheets to keep up with the movement and transmission of a deadly pathogen. So we're using 1980s technology to try to keep up with a 2021 fast-paced health problem, right? And the climate crisis is in many ways a similar story. We're not doing all that we can to invest in data systems and staffing capacity at our state and local health departments and at the federal level to understand this problem and address it. I do want to point out that part of this sort of approach in terms of applying case studies helps to get this story to a more local level. Oftentimes we hear about the climate problem in international or national conversations about it, but very rarely do we hear much more localized stories in terms of states and cities that are dealing with the climate problem. So we were heartened to see some coverage flowing from this study, and we hope to see more of a focus on local backyard impacts from the problem so that people can understand that they have agency and that they have a stake in advocating for stronger policies at all levels of government. I also want to point out that we have seen some early kind of uptake of this type of approach in other policy settings. So this is a report from the Wisconsin Governor's Task Force on Climate Change published last December that really pointed out to the economic ramifications of the problem for Wisconsin, a state that we looked at for extreme heat. So increasingly, we're making the case to policymakers at all levels that the financial implications on health are important to consider, even though they're not appearing in many headlines right now. Since I'm at GW, I just wanted to draw attention at the close of my talk to a few things. First is the need to broaden student training on climate and health topics. I, through my academic training, was really never exposed to an integrated approach to explaining what the climate crisis means to public health. I had to seek that out on my own, and many students continue to do so. But really, we need a much more comprehensive curriculum that's based on really centering health in terms of understanding of the climate problem. So this paper really spells out how to do that in terms of making it clear just how fossil fuels are worsening population health, not just in the US, but across the world, and the ways in which mitigation and adaptation can help us to cope with unprecedented public health risks from the climate threat. I also want to step back for a few minutes and just talk about the recent conclusion of COP26 and the ways in which that sort of connects to what we face in terms of a public health community and a policy response. So on the right side of the slide, you'll see that right now, current pledges from global leaders basically point to a future of about 2.4 degrees centigrade warming by the end of the century. So, of course, the atmosphere doesn't care about nice words on paper or pledges. It cares about action, right? And so even if you translate, ambitiously what's on paper into actual greenhouse gas emission reductions, the science indicates that we're still headed for well above a 2°C warming scenario by the end of the century. Of course, there's been a lot of discussion about keeping temperatures well below 2°C or about 1.5 degrees Celsius maybe. But right now, we need to really understand the take home from the last 2 weeks is that we are not on a path to achieve 1.5°C unless we have even more ambition and action urgently, right? So I want to just connect that finding to another key paper that Chris Ebi and other colleagues published just this year, pointing to the different non-linear health risks associated with climate change. So this paper that's cited at the bottom of the slide really points out to 3 different adaptation futures, right? So as much as the big conversation is about reducing fossil fuel emissions, we also need parallel discussion about bolstering investment in adaptation and preparedness. So these 3 scenarios here, 1, 2, and 3, spell out different futures of adaptation, right? Are we going to have a proactive approach with lots of partnerships and cross-disciplinary collaboration? Or on the left side, are we going to have a much more reactive approach and just sort of let things come to us as they are, as we have been doing for so many years? Those decisions have key ramifications in terms of population health and human well-being in the years to come. So this is another figure from that paper, what's called the burning embers approach, which gives you a sense of the different futures that we face depending on adaptation decisions made in the next, in the near future. So I just have pointed out where the sort of 2.4 degree C target or where that endpoint might be on each of these slides, portions of the figure. You can see that no matter which health problem we're talking about, whether it's heat, ozone, infectious diseases like malaria or West Nile, we face a better future if we have much stronger collaborative, proactive approach to adaptation, right? So the risk transitions in many cases from high to at least moderate, maybe manageable risk, if we really have expanded ambition and financial investment in preparedness. Adaptation looks very different depending on where you are in the world. We're talking about all sorts of things: early warning systems, cooling centers, proactive approaches by public health integrated with other functions at the city and state and federal level in this country, for example, to prepare people for what's coming and to keep people out of harm's way so that they're not ending up in a hospital or an emergency room. I also want to point out that oftentimes the discussion in this country focuses on, well, what can we teach the rest of the world about climate adaptation or climate change policy in general? Really, the reverse is true in many cases. Places like India, where NRDC does a lot of work with local partners on heat preparedness, have a lot to teach the United States and other countries that are increasingly going to be coping with extreme heat. Ahmedabad in the western state of Gujarat in India has been leading really for the last 8 years on what's called the Heat Adaptation Plan, a way to prepare city governance and citizens for the health risks of extreme heat, explaining that heat is not just an inconvenience, but a very significant threat to human health. And so this comprehensive heat adaptation plan has been in place for about 8 years now. The early epidemiology evidence indicates that that strong investment in preparedness is already paying off. The city has helped to avoid more than 1,100 deaths each year since the plan has been implemented. Right now, we have not enough investment in adaptation, and certainly we have not enough investment in understanding the health ramifications of bolstering preparedness in settings across the world. So we really need more of this to understand what works best, what are the best practices, and what health benefits can be achieved by upfront investments in adaptation. That plan in Ahmedabad has been thankfully scaled up now across the country to more than 30 states. 100 plus cities are now implementing their own heat action plans based on local conditions. These plans take advantage of heat forecast information from the central government to tailor forecasts and a city level response, including in the health sector, to prepare for example, an influx of patients in emergency rooms dealing with heat stress, heat exhaustion, and dehydration, for example. So this type of example in terms of comprehensive stakeholder planning and integrated approaches to heat adaptation holds lessons, I think, for other areas, including the US, that are going to be facing this problem in the years to come. So with that, I'll just wrap up with a couple of final slides. First, just some policy recommendations. And I think any of you who've been following the climate issue in terms of health won't be surprised by these. First, of course, we need to rapidly transition our world away from the fossil fuels, coal, oil, and gas that are contributing to greenhouse gas pollution and the unprecedented environmental changes that we're seeing around us. There's more CO2 in the atmosphere right now than there has been in the last 3 million years. That means that our human experience is really uncharted territory in the years to come. We also, though, need much more of a focus on adaptation. It can't just be about greenhouse gas reductions, because we know that we've baked in a lot of harm, ongoing, incoming harm in the years to come in terms of the mounting climate risks. So we need a lot more of a focus and investment on adaptation. Also, we need to improve data surveillance and tracking, and hopefully this case study has made the case on that front. And we need better cost estimates. We need to know what people are being burdened by in terms of their finances from these health problems, so that we can better prepare and we can better respond. We can, work with health insurers. We can make sure that Medicare and Medicaid are thinking about climate when they think about future projections, to make sure that those programs continue to remain around in the years to come for many vulnerable people who will continue to need them. I'll also just say that we need more people talking about the health problems associated with climate change. I published this op-ed back in the summer, really trying to draw attention to the fact that while we might not see health numbers in the headlines as much as we see the number of acres burned by a wildfire, for example, we really do need to understand that behind many of these headlines about climate hazards are real people, families, children, grandparents, teachers, all sorts of Americans and people across the world dealing with profound, sometimes irreversible damage to their health, right? So more and more, we need people talking about the climate problem in terms of a health issue, right? And the World Health Organization published a report right before COP, focusing on the health argument for climate action and the ways in which those emission reduction pledges back at COP can help to deliver on health equity and advance public health causes across the world. So I'll just wrap up with a few thoughts on mental health. I think a lot of people working on the climate problem struggle to deal with this unprecedented threat, to be thinking about it day after day in terms of profound damage to human health. Oftentimes it's easy to lose sight of how far we've come on environmental management in this country and pollution control. This is a picture of New York City back in 1966. It's probably unrecognizable to many of you who've been to New York in even the last 10 or 20 years. And that's because the Clean Air Act passed in 1970 is really responsible for cleaning up America's air pollution problem and extending lifespan across this country by more than 2 years. When you add up all the health benefits associated with pollution control for the Clean Air Act, you end up with a $2 trillion health benefit. That outweighs the cost of cleaning up our air by a factor of more than 30 to 1, according to the Environmental Protection Agency. So clearly there's huge gains to be made in terms of public health and economics by acting on problems before they get even worse, right? And the same is true for the climate problem. We know that action on this crisis, on mitigation and adaptation, can help to avoid unnecessary loss of life, unnecessary illness and injury, and also help people to avoid billions of dollars in health costs year after year. So right now is really the moment to step up for climate action and make the case that we need these investments now. We need action now on greenhouse gas pollution in order to ensure a safer, livable future for all of humanity. So with that, I'll wrap up just with my contact information, and I look forward to some great Q&A with you all. Thank you.
Thank you so much, Dr. Lamai. Such inspiring and clear messages there. Thank you so much for highlighting the many ways in which climate change will influence public health, but also going beyond that and thinking through what we must do going forward. We have some questions that have been put in the Q&A, which we will start asking, and a few from Jonathan Patz, whose name was invoked earlier. So we will promote Jonathan to a panelist so that he can ask his question. And while we're doing that, I'll just ask a question of my own. You reflected a little bit about COP26, which just concluded, and I wondered if you could just say a few words about how you perceive the discourse on health and climate to be changing in relation to, I guess, U.S. climate action as well as international climate action. Do you see it kind of getting stronger, and what more needs to be done to make health a critical consideration?
Yeah, great question. Thank you. So I do think that, even in just the last 2 weeks, we saw a really kind of vivid example of the need to prioritize human health in international climate negotiations. I think we saw the UK presidency for the first time include health as a main pillar of its programming. The World Health Organization should have been at COP for the last 25 of them, right? But for the first time, it was represented in a more significant way. We saw countries, even in the closing session over the weekend, point out to the need to understand the climate harms to their populations and their regret that more of that emphasis wasn't included in the final agreement. I also think that the youth climate movement has really drawn attention to the existential threat posed by this problem, and that children are talking about threats to their own lives, which is accurate, right? It's in line with the science, but we really haven't seen the framing align with that human experience in the past. I think a lot of the focus has been on technology, what geoengineering can we implement, or, looking at solar and wind and other renewable sources, and really kind of taking human suffering out of the conversation. And I think, in terms of what's been happening just this summer across the country, we've seen members of Congress much more comfortable talking about how the climate problem is a risk to their own constituents. So I think, as the science continues to catch up, we can fine tune those messages, but I'd also say that the science is very clear about what we're already seeing on the ground. We don't need to wait for the latest and greatest attribution study of each event to necessarily pinpoint what's happening. Right now, time is the ultimate, decider here. It's not about sort of the perfect response, it's about the most urgent response. And so I'm heartened by that. And but I do think that the youth kind of focus on the human experience here has been really helpful in shifting the narrative.
Great, thank you. So Jonathan, we will turn it over to you.
Well, I didn't realize you were going to put me on the spot and on the panel here. But yeah, great presentation, Vijay. And just a quick question about the attribution question for, the multifactorial aspect of some of these diseases, especially Lyme disease, harmful algal blooms, which depend on other things besides climate. How did you grapple with that and, pull that together as far as your, attribution to climate? Not climate change, but just to weather extremes.
Oh, sure. Yeah. So, thanks, Jonathan. Yeah. In the 2012 case study, look, we did delve pretty deeply into each state level case study to explain the unprecedented heat that happened in Wisconsin in early July that year. And we did sort of explain how what was experienced in 2012 was emblematic of the types of environmental linkages that are spelled out in the National Climate Assessment. We also did acknowledge that, for problems like Lyme disease, West Nile virus, for example, of course, there's really complex ecology to take into consideration. Even for a problem like wildfires, right? We're seeing that increasingly, the confluence of where human structures are built and this kind of human-wildlife interface is part of the challenge here. So that's why, I'll just caveat, the entire piece of work and say that we didn't, conduct additional climate attribution for any of these case study events. For 2012, actually none that we could tell was done. So, I think as that project continues to gain speed, especially in extreme heat, we can arrive at some more convincing estimates of the climate signature here. But I think it also speaks to the larger issue. We don't talk about the large burden of a problem like air pollution on, rates of lung and heart disease across this country, even though it's very clearly, implicated in a worsening of each of those problems. So I think in some sense, it's also just an effort to draw attention to the significant public health burden of environmental exposures writ large, not just climate ones.
Thank you, Dr. Lamai, and thank you, Dr. Patz, for allowing us to put you on the spot and ask your questions. Really appreciate it. There's a few more questions in the Q&A, so I'll just try to ask them in order. Great data on health impacts. I'm curious on follow-up regarding longer-term health impacts, including increased cancer burden.
Oh, yeah, good question. Okay, so one sort of critique that I mentioned about the existing kind of state of affairs is that right now we have a really kind of short-term memory when it comes to tracking health effects, and even like public reporting and journalism, for example. So, we took advantage of published epidemiology studies that looked at, for example, the mental health burden, substance abuse and anxiety that people in, New York and New Jersey experienced after Hurricane Sandy, for example. For many studies, the diagnostic coding, what's happening in hospitals and emergency rooms is doctors are going in and writing down a code for what they see as the affliction that a patient has. Oftentimes, it's very difficult to track that over time and to understand the patient's evolution of disease. Development of cancer many years later, for example, would be fall under that issue. So I would say that generally we kind of confined our analysis to the immediate acute impact of these events, but there's certainly I would suspect that in many of these cases, patients, if you suffer an injury, you may have a worsened outcome in another situation. So I would say that we kind of lacked visibility into that, and just due to kind of the details of medical billing, but certainly we need much more kind of longitudinal tracking at the community level to understand the burden of climate hazards.
Great, excellent. And another question related to lack of data, which I'm glad was brought up because I wanted to share my anecdote that I'll never forget the day that I was doing a research study on climate change impacts on aeroallergens, and someone shared data with us in Quattro, which I had never heard of before, but is a predecessor to Excel. And so I think what you were saying in terms of the antiquated way in which we are storing and sharing data really resonated with me. And so the question is, do you know of any effort made to make these data more accessible to researchers?
Yeah, I think actually I'll just point out, I didn't get to really focus on this, but I'll just show on one slide. It was actually really cool this past summer. We saw the Centers for Disease Control and Prevention, sorry, just one second, let me pull it up, deploy what it calls its National Heat and Health Tracker. So this was really, you can see at the lower right of this slide, this is the address is there. This is really much.
Sorry, Vijay, we're not seeing a slide.
Oh, sorry. Is it there now?
Yep.
Okay, so you can see at the lower right of the slide, you can see the US divided up into different health and human services hospital care delivery regions here. And you can see the number of heat-related illnesses in each of those HHS regions. And this is relatively recent data. You can see here that this was like June 13th to 19th this summer. Oftentimes we're having to wait a year plus to access that type of information from CDC. So I think, we would love for this data to be even more granular, right? Like maybe a state or county level, but this is certainly a step forward. I think CDC is aware of the issue. I was reminded today, right now, CDC is, its budget is shoestring relative to the scale of this challenge. Right now, in terms of CDC grants to states and cities, we only have 11 total grants on CDC's climate and health program across the country. That's 9 states and 2 cities compiling data and trying to improve their data collection systems. So certainly, we've seen progress on this front, but there's a ton more to do to bring these data tracking systems into, 2021.
Great, thanks. And we probably only have time for one more question, but we will try to preserve all of these questions and send them over to Dr. Lamai, and hopefully they'll be, helpful as you go forward in your work and think about, things to communicate in the future as well. But there are a couple of questions about your points on the need for more education on climate and health. And we are an academic institution. We are working on integrating climate change more into the public health and medical school curriculum. And so I think this is a very timely discussion to be having with you, and thank you for your insights. And the question is, can you say more about what education you think we should provide to our students? Your talk made me think we should do more to work with health policy to evaluate whether that is an area where we could expand. Do you have specific suggestions?
Yeah, sure. And I'll just show that kind of list of climate and health literacy elements that we came up in that recent work. But I'll just say, big picture wise, I think we need a lot more focus on the ways in which the climate problem, whether we like it or not, is going to, redefine a lot of career choices and career paths for students right now. So we need students, I think, more and more focused about dealing with the human, linkages here, dealing with health policy, dealing in legal settings with the ways in which patients, may be suing, right, if they can attribute a harm to the climate crisis, a specific, pathway there. I think also we just need much more of kind of a human-centered approach to talking about the climate problem. For so long, it's been about polar bears and glaciers, rather than people ending up in really scary situations in terms of risk to their own health. And so I think there's ways using like these literacy elements also just to broaden and advance scientific literacy, understanding what data sets mean, how to make sense of complexity and design public policy around complex issues that have very clear equity implications, right? So I think in many ways, we need to refocus our teaching on environmental issues and climate issues specifically around the human experience. And maybe these literacy elements are a way to start doing that.
Great, thank you so much. That's all the time we have for the Q&A, although it's painful to break this off because there's such great questions, and I want to keep having this conversation for another few hours. But I know we have other meetings we need to get to and such. So I just want to thank you so much for sharing your time and insights with us today. And your work is really cutting edge, and not just that, but really pulls together a lot of the science to inform education and policy. So just very much appreciate the line of work that you're leading. And thank you all to all of our attendees here today. We will convene again in a month for our next webinar, which will feature Dr. Renee Salas. And have a great month in the intervening period, and happy Thanksgiving to everyone. Thank you so much.
Thank you.
Take care. Bye-bye.